Good afternoon. My name is Tiffany DeBoer, and I'm the Public Information Officer for Calhoun County. I'm here today with Lindsay from ADPH, or Alabama Department of Public Health, and we're going to be talking about COVID-19 as well as the upcoming flu and cold season. And so, first off, I'm going to just kind of give an update of COVID-19 in Calhoun County and how we have been doing here. And so, we have about 3,183 total cases. But as I mention every week, we like to look at other metrics to see how we are doing as far as community spread goes. And so, since our peak, late July, early August, for about the last 8 weeks, we have been pretty stable in our numbers. On average, we've seen about 215 cases per week. And last week, we had just under that with 183 cases just last week. And we have confirmed 36 deaths due to COVID-19, and there are 8 other ones being investigated by ADPH. And so those 8 probables are also listed on their dashboard. And so if you want to find out any more information about the numbers or how Calhoun County is doing, you can go to ADPH's dashboard and find all of those, as well as our risk indicator map, which we are doing well in that area as well. So now I will turn to Lindsay, and she is going to give us a little bit more information about what Alabama Department of Public Health has been doing lately.
So, good afternoon, and thank you all for having us.
Yes.
We appreciate the opportunity. The Alabama Department of Public Health has implemented an infection prevention and control team across the state in our different districts. We consist of the Northeastern District, and that is 11 counties. Our teams coordinate disease outbreak clinics. We also provide employee health services to our employees, and we collaborate with the community and community agencies for infection prevention outreach and education.
All right, and so what are some goals that your team has for the community and preventing disease spread here?
So our goals, of course, are infection prevention by working with the community and different agencies to help spread the word for prevention and education, so that we can hopefully see a decrease of COVID-19 as well as flu and cold season.
Right. Okay, and so what are some different ways that you go into the community and help to spread awareness and educate or offer clinics and things like that?
So we've met with agencies to provide outreach and education. We've reviewed the school toolkit and things like that, and helped provided important information for prevention and preventive measures, cleaning and disinfecting facilities, and then just we're doing right now, of course, COVID testing sites as well as drive-through flu clinics.
Okay, and so how often are you doing the drive-through flu clinics now?
We're doing them weekly. We host anywhere from 2 to 3 clinics a week. And like I said, we're in 11 different counties. So wherever the community need is, we do drive-throughs at the health departments as well as off-site.
Right. Okay, and then, so why is it important for the community to get their flu shot, especially now during COVID-19?
Well, it's important to get a flu shot. You usually see a peak with flu season around January and February. The symptoms are the same, so we know that we have a vaccine right now to help prevent or reduce the spread for flu. So we encourage everyone to get their flu vaccine by the end of October. And just to know the facts, knowing that the signs and symptoms are the same, and to practice good hand hygiene and take those preventative measures.
Right. And so if the symptoms are similar, uh, do you feel like, or are doctors and Alabama Department of Public Health prepared for the testing that may have to increase to be able to differentiate between flu and COVID?
Absolutely. We're willing to, we're still doing on-site COVID testing in all of our county health departments, and we continue to provide those services. But we hope to see a decrease with infection,
Right.
with mask wearing and distancing from others. So
yeah. So with distancing ourselves, wearing our mask, for COVID, it's likely that it could decrease flu and cold as well, possibly because we have those measures already in place.
Absolutely. And your best defense is going to be, of course, washing your hands, good hand hygiene with soap and water for 20 seconds or more, wearing your mask, covering your cough and sneeze, staying home when you're sick, and try not to, be around other individuals who are sick.
Right. And so we're saying they seem similar, flu and cold and COVID. Is it possible to contract COVID-19 alongside the flu or strep or cold or any of those types?
Absolutely. So infectious viruses like these, they live on surfaces and contact person to person. So if you are infected with one, you are now immune compromised, so that you're more at risk for acquiring another infection.
And so I assume, and you can correct me if I'm wrong, so if you contract COVID and you are immune compromised and then you contract the flu, that's extra stress on your body, and it can really just bring your immune system even further down. And is that why it is important to go ahead and get the flu shot, since we do have a vaccine for it?
Absolutely. We want individuals to prevent flu by getting their flu vaccine. And we do know that comorbidities and immune compromise, even pregnancy, all those factor in making you more at risk for developing, symptoms and complications.
Right. And so can you discuss a little bit more about how the flu vaccine kind of operates, as far as like why we get the flu vaccine?
So when you receive the flu vaccine, when it's administered, your body is going to develop antibodies to that, and it can take up to 2 weeks to develop those antibodies. So, the misconception is that individuals receive their flu vaccine and then say, 2 or 3 days later they got diagnosed with a flu.
Mm-hmm.
Well, they did not have their antibodies built up for that to have helped prevent that. Right. Now, the flu vaccine is, very successful in preventing flu, but also those who have come in contact with the flu virus and get their flu vaccine, it can help, reduce those complications and the severity of the disease.
Right. Okay. And then, so do you have any more insights to the impacts of COVID-19 on flu season, or why we go into flu season?
Just to be diligent, for the community to not give up just yet, that what we're doing is working, wearing our mask, distancing, good hand hygiene, wiping down and disinfecting, surfaces that are used a lot, and, to get that flu vaccine.
And so where can you get flu vaccines throughout the county, or in general for the region?
So you can call any of your local health departments to set up an appointment to get a flu vaccine, and we encourage you all to call and find out about local drive-through flu clinics that we're hosting, and that will help minimize your risk of coming in contact with someone who's infected with a virus, and hopefully make it easier and convenient for you.
Right. And so speaking of community test sites. We have one coming up for Calhoun County, correct?
Correct. We have an off-site flu clinic that we are partnering with EMA, and it is on Wednesday, October the 7th, from 8 a.m. to 12 p.m., and it is going to be located at 11th and Grove at the DHR intersection, and we hope to have a good turnout.
Right. And so we do encourage all of you to come get your flu shot next Wednesday, October 7th, to help minimize the risk as we move into, this next season. Is there anything else that you would like to reiterate for the community as far as preparation or how they can get more information?
Just they can go to adph.org or, of course, CDC website for the current recommendations, but that, we ask everyone to come out and get their flu shot.
Yes, absolutely. All right, so make sure as we move into flu and cold season, along with COVID-19, you continue to wear your mask, watch your distance from people, and wash your hands. So that you can remember that by the 3 W's. That's an easy way to remember those 3 things that we need to be doing. And are there any other questions from Facebook? All right, no. Well, thank you guys for tuning in. And remember the flu clinic next week, October 7th, and we hope to see you all there. And thank you for coming.
Thank you.